Hi, Assalamualaikum and hello everyone. Today our group will be presenting about breast cancer detection using microwave imaging technology. And yeah, my name is Azwa Safrina binti Romi Husaini and this is my group members Nur Alia Maisara binti Muhammad Zaki, Nuraina Hasha binti Nizam, Nur Auni Nabiha binti Ahmad Junaidi and Madiha Syafini binti Mawardi. And as you can see, this is our list of content based on our topic.
Breast cancer is one of the most common and deadly cancer among women worldwide, highlighting the urgent need for diagnostic methods that are accurate, effective and accessible. Traditional imaging techniques such as mammography, MRI and ultrasound are useful but have limitations, including exposure to ionizing radiation, discomfort during the procedure, high cost and decreased sensitivity in the breast tissue. In this context, microwave imaging technology presents a promising alternative that can overcome many of these issues. By exploiting the differences in dielectric properties between healthy and cancerous tissue, microwave imaging uses low-power electromagnetic waves to identify abnormalities within the breast without exposing patients to radiation, making it safer for repeated screening. Its importance lies not only in the potential to improve early detection but also in its ability to offer a non-invasive, affordable and portable option that can be used widely, especially in areas with limited resources. As ongoing research progresses, microwave imaging has the potential to transform breast cancer diagnosis by providing a more comfortable, safer and accessible screening method, which could lead to early treatment, improve patient outcomes and lower mortality rates. Breast cancer detection using microwave imaging technology represents a significant advancement with the potential to greatly enhance diagnostic method. This technique is based on the understanding that healthy and cancerous breast tissue have different dielectric properties such as permittivity and conductivity, which are fundamental concepts in physics related to how electromagnetic waves interact with matter. Microwave imaging employs low-power electromagnetic waves, typically in the frequency range of 1 to 10 GHz, that are transmitted into the breast tissue. These waves interact with the tissue according to their dielectric characteristics. Variation in the reflected signal resulting from differences in tissue permittivity and conductivity are analyzed using principles from electromagnetic theory, such as Maxwell's equation, to identify abnormal regions like tumor. Unlike traditional imaging methods such as mammography, microwave imaging does not use ionizing radiation, making it a safer option for repeated screening and reducing health risks associated with radiation exposure. Additionally, the technique is non-invasive and generally more comfortable for patients, often involving placing the breast inside a specialized device that emits and detects electromagnetic signals. The data collected is processed using complex algorithms such as inverse scattering and tomography to generate images that highlight areas of concern, aiding in early detection of malignancies. This technology is particularly useful for screening dense breast tissue, where conventional methods often have lower sensitivity due to the strong contrast in dielectric properties between healthy and cancerous tissue. Moreover, microwave imaging systems are usually portable and potentially most cost-effective, making them suitable for use in resource-limited settings. Although still in the research and development phase, microwave imaging has shown promising results in improving early detection rates, enabling more frequent and accessible screening, and ultimately improving patient outcomes. As ongoing research progresses, this innovative technology has the potential to transform breast cancer diagnosis by offering a safer, more comfortable and widely accessible alternative to existing imaging techniques, all grounded in the fundamental physics of electromagnetic wave interaction with biological tissue.
For this slide, I will be explain about what's make microwave imaging important technology for breast cancer today. The first one is for protect women's health by using non-ionizing radiations. Some people scared to checking their breast health because they think it will be exposed to a high radiations. But this time, microwave imaging have been improved by using non-ionizing electromagnetic wave, which means it does not expose the body to a harmful radiations. This makes it more safer, especially for someone want a regular checking and scanning. Not only that, when using a microwave imaging, the risks are eliminated, making it more suitable for any ages to use, even in a younger woman under 40 age or a woman during her pregnancy. Second one is improve early detection in a woman with dense breast tissue. Some women have called a dense breast tissue. This means their breast have a less fat and more granular tissue. It is a naturally condition and a very common happens in a woman, especially in a younger age and Asian women. But they have some problem with it because the dense tissue make it hard for X-ray to see the cancer clearly. By using microwave imaging, it works in smarter way. Instead of looking at the shape or the shadow like X-ray do, microwave imaging look at the electrical properties of the tissue, for example, how much water is inside. Basically, cancer tissue usually have a more water and a different electrical signal, so that the machine can easily scan and detect or spot if the breast tissue is dense. Next, by using microwave imaging, it gives a better chance of early detection and it also helps to the doctor to not missing out anything, so that it's make more a woman or a patient more confident in their checking up. Next, by using microwave imaging, it gives a better chance of early detection. It is a good for a woman more confident for make another checkup. For the third one, the key to survive from breast cancer or even not from breast cancer, for all cancer, is by checking up early to the hospital. The early it's found, the more treatment options are available to prevent, and also the cell cancer less aggressive for those treatment need to be. By using microwave imaging, it can detect even a small and early stages of abnormalities. In fact, if in early stages like stage 1, the probability of breast cancer to survive is a high, which is 90%. But many women right now don't feel a symptoms until the cancer has grow. By that, the treatment it will be longer and it might be harder to recovery. The time will be longer. That's why early detection is a super duper important to prevent, and also we can save our life. Not only that, early detections help women to stay healthy for their family, career, and future. If we free from any problem, it makes less of fear and stress. What is Maria imaging? This medical breast imaging system developed in the UK. The company name is Micrima. It's designed to help detect breast cancer in a safe and comfortable way, especially for women with dense breast tissue. By using a traditional way like X-ray, it may not work. So by using a Maria imaging technology, it works and it's very helpful. So what does Maria detect? Maria detect an area of a tissue with a higher water content. Like I said before, cancer breast can detect if they have a lot of water. So Maria detect an area of a tissue with a high water content, like a tumor, will show up early. Why we choose Maria as example implementation in real world? So the first one is they have no radiations because it uses a radio wave. It is not too harmful like X-ray works. The second one is it is safe for repeated use and even women during her pregnancy. The third one is it's a very quick to scanning. It is usually done 10 to 20 minutes, so it is save our time.
So now, I would like to talk about the potential and challenges of using microwave imaging technology for breast cancer detection. So let's begin with the potential. Microwave imaging is a very promising technology because it does not use ionizing radiation. This makes it safer compared to traditional methods like mammograms, which use X-rays. In addition, microwave imaging is cost-effective, meaning it could be more affordable for hospitals and patients in the future. Another important point is that no breast compression required, making it more comfortable for patients. However, despite all these benefits, there are still some challenges. One of the biggest problems is the low image resolution. The images produced by microwave imaging are not as detailed as those from MRI or ultrasound. This makes it harder for doctors to identify small tumors. Also, the technology is still new and under research, so it is not yet widely used in hospital. It requires complex algorithms to interpret the data, which means more development is needed. There is also a risk of false results like detecting something that is not cancer or missing a real tumor. This can lead to confusion or delay in treatment. And finally, because the technology is still growing, access is limited and not all hospitals have this equipment yet.
Next is future developments and innovation. So there's two. First is smarter detection using AI. Computers will help read the scans more accurately. AI can find early signs of cancer faster than human beings. Second is wearable tech for daily monitoring. So for example, special bras or patches with sensors that let women check their breasts at home, especially women that has high risk of getting the cancer. So these devices analyze temperature changes and tissue densities, indicates of possible metabolic changes associated with the tumor growth by alerting the users to these changes sooner. So individuals can seek medical evaluation early, and it can increase the chances of successful treatment and survival.
In conclusion, microwave imaging is a promising innovation for breast cancer detection, offering a safer, non-invasive, and more comfortable alternative to traditional methods like mammography. It works by detecting a difference in tissue properties using microwave signal, which means no radiation exposure and the potential for real-time imaging. This makes it especially useful for frequent screening and for women with dense breast tissue, where current methods are less reliable. Real-world studies have shown positive results, but there are still challenges such as improving image resolution and accuracy. Even so, ongoing developments in sensor technology and AI integration are quickly advancing the field. Researchers are also exploring portable and low-cost systems, which could make early detection more accessible in rural or underserved areas. Overall, this technology has the potential to greatly improve early diagnosis and save lives. It shows how physics can be applied in powerful ways to solve real-world health problems, and that's what makes this topic so important and exciting to explore.